It is World Sight Day, a time dedicated to the importance of quality eye care. Joining us live to talk about that, Dr. Brian Armstrong and Dr. Ivy Thornton, both ophthalmologists with Nebraska Medicine. Thanks so much for being here today. First, I want to talk about World Sight Day and why something like this is important.
You know, we really want to raise awareness to people in the community and the world about the importance of regular health checks. And World Sight Day gives us an opportunity to bring attention to that. We know that 90% of the disease that blinds people is either treatable or preventable. And so if people know that regular eye checks can prevent vision loss down the road, I think that's a great thing, and it's important for people to know about, and we want to encourage people to do so.
Do you think most people get regular eye exams?
We don't. We take care of people all the time that are coming in for the first time over the course of 10 to 15 years. In some cases, they have conditions that could have been intervened upon earlier and prevented further vision loss or visual decline in some cases. So, you know, that's the point of the day. It's just making that awareness much more prevalent, and that's why we're here today.
And if there's a fear of cost, most insurance programs probably cover annual eye checks.
That's right. Obviously there are people in the community that are uninsured, and so we try to offer opportunities for those people to come in for screenings, free screenings. There are plenty of networked healthcare facilities that take care of people that are underinsured. But for those people that are insured, it makes perfect sense. And, you know, it's important for people to have their eyes functioning well because it increases productivity at the workplace. And that's the focus of this year's day, is how do we care for our eyes at work? And having great vision at work improves our productivity by 22%. And so that's another important piece of why we're here. And there are some procedures like LASIK that can provide great quality vision.
Let's talk about LASIK.
Yeah.
How has LASIK changed over the last decade?
Yeah, Bill. So there has been just like tremendous development in the world of LASIK. Number one is the safety profile. We now have just cutting edge diagnostic tools to just make sure you're a good candidate for LASIK surgery. And this, of course, just increases the long-term success of good quality vision. Second of all, it's just a technology. We now have technology that can actually treat the shape of your cornea, your own cornea, to give you your glasses prescription. This technology is called Contour Vision. And lastly, there's now also eye surgeries that can actually improve and get rid of a glasses prescription that is not LASIK. One particular is called the ICL, standing for implantable collamer lens. This procedure does not require a laser. It is reversible. In other words, if you don't like how you see, we can actually, revert back to your original glasses prescription.
What do you tell people who are scared of that word LASIK, if they're fearful to get the procedure?
Well, I think that's the reason why I want to bring up the safety profile. It is a very straightforward procedure. I've done it to my family member. There's really nothing to be afraid of. I have it myself, and I just love how I see right now. So.
Doctors, thank you so much for joining us today on World Sight Day.
Thank you for having us.
Welcome. Thank you, Bill.